1 million workers in CMCO areas to work from home beginning tomorrow. MOH studies, monitors side effects in recovered COVID-19 patients. You're watching Updates at Noon with me, Renee Fong, on TV2. Public and private sector employees in managerial and supervisory positions in states under the Conditional Movement Control Order, CMCO, have been directed to work from home beginning tomorrow. Senior Minister Datuk Sri Ismail Sabri Yaakob said the decision was made on the advice of the Health Ministry to limit the movement of people and prevent new COVID-19 infections. Datuk Sri Ismail Sabri explained that the directive to work from home depends on how long the area is placed under conditional MCO.
Difahamkan 800,000 pekerja sektor industri dari wilayah Persekutuan Kuala Lumpur, Putrajaya, Labuan, Selangor dan Sabah akan terlibat dengan keputusan yang kita buat hari ini, 800,000. Manakala yang melibatkan penjawat awam di kawasan tersebut adalah seramai hampir lebih kurang 200,000. Bermakna 1 juta. Jadi kita boleh kurangkan pergerakan 1 juta pekerja. Dan ini saya kira boleh membantu untuk mengurangkan jangkitan COVID-19 ini.
However, he said exceptions are given to employees who are required to work from offices such as those in the financial sector, enforcement as well as welfare offices. As for workers living in the red zone areas, they will be required to undergo swab tests. Foreign workers in the construction sector as well as security personnel are also obliged to undergo COVID-19 testing. Datuk Sri Ismail Sabri added that the Ministry of International Trade and Industry will be issuing a media statement on this directive soon. On another note, Datuk Sri Ismail Sabri said the Enhanced Movement Control Order EMCO will be imposed on Kampung Saguking Laut and Kampung Sebor Baru in Labuan from 21st October to 3rd November. He said 8,062 residents of the two villages will be affected.
Pelaksanaan PKPD ini bagi membolehkan pergerakan keluar masuk di kawasan tersebut dapat dikawal dan juga untuk memudahkan kerja-kerja saringan yang akan dibuat oleh Kementerian Kesihatan.
Datuk Sri Ismail Sabri said the villagers have also been instructed to observe home surveillance order and to wear the surveillance wristband. He said the villagers were not allowed to work during the MCO period, adding that all social and recreation activities as well as barter trade are also not allowed. Meanwhile, Datuk Sri Ismail Sabri said the Malaysian Armed Forces have agreed to set up a makeshift treatment centre MTC at the Kepayan prison to support the COVID-19 medical facility in the prison. The decision was achieved after the presentation by the Sabah National Security Council NSC during a special meeting chaired by the Prime Minister yesterday. Elaborating further on the matter, Datuk Sri Ismail Sabri said the MTC is needed as the number of COVID-19 cases in the prison has increased and it will serve as a quarantine and treatment centre for inmates who test positive.
MTC ataupun makeshift treatment center itu adalah model yang serupa seperti yang telah dilaksanakan di penjara Pokok Sena Kedah sebelum ini dan persediaan akan dilakukan dalam masa yang terdekat.
The senior minister added that the Armed Forces Field Hospital in Tawau will also start to operate this week and have begun receiving on non-COVID-19 related patients yesterday. He also said the operation of the field hospital will focus on non-COVID-19 patients, while the government hospital will be focusing on the treatment for COVID-19 patients. The senior minister further noted that should the number of cases in Sabah continue to increase, the armed forces will be ready to set up more field hospitals in areas advised by the Health Ministry. Health Director General Tan Sri Dr. Noor Hisham Abdullah says the Health Ministry is still studying incidences of side effects and complications in recovered COVID-19 patients. He was responding to a question if the Health had carried out any studies on former patients who are now suffering from complications from the virus and are incapable of leading a normal life.
Kalau pesakit yang ada jangkitan yang ringan, iaitu mild symptoms ataupun tiada gejala, mungkin efek ataupun kesan samping itu kurang. Tetapi yang pesakit yang ada jangkitan kategori ataupun tahap 4 dan 5, mungkin ada kesannya lebih, iaitu kita sedang melihat pada tempoh jangka panjang. Kalau tempoh jangka panjang sama ada keparutan dalam paru-paru itu akan menyebabkan dia kesesakan, sesak nafas dan sebagainya. Jadi ini kita akan lihat pada jangka panjang.
The Health Director General added that the Institute for Medical Research IMR is currently conducting tests to check on their antibodies of former COVID-19 patients. He noted that early reports showed that the antibodies built after one is infected decreases after 8 weeks. However, Tan Sri Dr. Noor Hisham said that there is still more to be learned and discovered about the COVID-19 virus and learning how to contain it, pointing out that it has only been 10 months since the pandemic broke. On another note, Tan Sri Dr. Noor Hisham said the Malaysian Armed Forces MAF Field Hospital in Tawau, which started operating yesterday, received 12 non-COVID-19 patients. He said the field hospital would receive more non-COVID-19 patients for medical treatment, pediatric care, gynecologic care and so on.
Contohnya pembedahan, perubatan, pediatrik, sakit puan dan sebagainya. Pembedahan juga boleh dijalankan di Hospital Medan di Tawau, iaitu lebih kurang 5 minit daripada Hospital Tawau, dan Hospital Tawau akan diguna pakai untuk pesakit-pesakit COVID. Jadi ini kerjasama antara Kementerian Kesihatan dengan Angkatan Tentera Malaysia.
When asked about the allegation on social media that COVID-19 patients at Tawau Hospital, Sabah, were only fed once a day, that is breakfast only without lunch and dinner, Tan Sri Dr. Noor Hisham denied it. He said a check with Tawau Hospital found that patients were given breakfast around 7 a.m, lunch around 12 noon and dinner around 5:30 p.m. The Health Director General noted that the Health Ministry has a fixed schedule for food to be given to patients throughout the day. The Sabah government hopes the processing of the still outstanding COVID-19 screening test samples could be completed in the next 3 to 4 days following the appointment of 3 private hospitals and laboratory to help speed up the work as announced on Monday. Sabah Local Government and Housing Minister Datuk Sri Masidi Manjun said he was confident the 3 medical institutions would be able to help the Sabah Health Department JKNS to complete processing the 10,400 outstanding samples.
Kita berharapkan sampel ataupun keputusan yang tertunggal ini dapat kita bereskan dalam masa 3 atau 4 hari. Dan kalau itu berlaku bermakna selepas itu, insya-Allah kita akan dapat, dan kita berharap kecuali ada infeksi baru, kita akan berharap akan melihat statistik yang lebih rendah selepas itu.
Datuk Sri Masidi said the COVID-19 statistics in Sabah, which were announced yesterday, to a certain extent was contributed by the outstanding screening test samples. Earlier, the minister said based on the report of the JKNS, there were 673 new cases recorded yesterday with 3 deaths. He said there were 8,755 cumulative COVID-19 cases in Sabah. And until to date, 3,223 patients had recovered, while 5,466 more were being treated in wards in Sabah. Datuk Sri Masidi also reminded the people of Sabah to continue to be disciplined by complying with the standard operating procedure SOP, such as wearing masks, physical distancing, regularly washing hands and not visiting public places unnecessarily. In the meantime, the minister noted that works to distribute food baskets from the state government to the target groups was proceeding smoothly, and until to date, 62,002 baskets had been distributed. Sultan of Selangor, Sultan Sharafuddin Idris Shah, expressed concern over the country's endless political turmoil, which is causing restlessness among the people. The private secretary to the Sultan, Datuk Muhammad Munir Bani, said His Royal Highness was also disappointed with most politicians who did not seem to care at all about the problems and hardships faced by the people, as well as their badly affected economic positions due to the impact of COVID-19 pandemic. The ruler, in a statement released, said the people have begun to get bored and disgusted with the acts of politicians who always seem to be fighting and quarrelling to seize control of the country's leadership. Datuk Muhammad Munir said politicians should be responsible for ensuring that the people's suffering remains their priority while exercising their responsibilities and duties. He added that the suffering and hardship of the people in their daily livelihoods must be immediately addressed and settled by taking drastic and effective approaches. Therefore, Datuk Muhammad Munir said Sultan Sharafuddin wants all parties, especially politicians, to work together despite their different political ideologies and remain focused to help solve the people and the country's challenges to fight the COVID-19 pandemic, as well as rebuild the country's economy, which had been badly hit. The Kedah government will instruct the relevant agencies to submit a detailed study on the proposed amendments to laws related to the use of land to curb the cultivation of ketum plants in the state. Kedah Menteri Besar Muhammad Sanusi Mat Noor said he would discuss the matters related to the proposed amendments as well as ketum planting in the State Executive Council meeting today.
Mungkin akan arahkan untuk agensi untuk muka laporan. Apakah tindakan boleh diambil bagi penanaman ketum berdasarkan akta lah. Kanun Tanah Negara, akta racun, akta dadah membahaya.
Previously, Kedah Police Chief Datuk Hasanuddin Hassan proposed that the state government amend laws related to the use of land to curb rampant ketum planting activities in the state. Datuk Hasanuddin was quoted as saying that the amendment would enable enforcement action to be taken against individuals who planted ketum trees and involved in the abuse of ketum leaves. Meanwhile, Muhammad Sanusi said the state government was also focusing on efforts to combat the abuse of synthetic drugs in the state, as it has huge impact to the society, which may lead to social unrest and an increase in the crime rate. Majlis Amanah Rakyat MARA will take stern action against the food operator if there is any evidence of negligence behind the food poisoning of 207 Kuala Kelawang Maktab Rendah Sains MARA MRSM students in Jelebu, Negeri Sembilan yesterday. MARA issued a statement stating that action will be taken if those who prepared the meals were negligent and failed to adhere to standard operating procedures during food preparation. The statement also said that MARA takes such issues seriously and was investigating in detail to identify the exact cause of the incident, adding that it would obey the Jelebu Health Officer's instruction to close the Kuala Kelawang MSRM Food Hall for 2 weeks to facilitate the cleaning process and further investigation. To ensure that the students' needs and well-being is taken care of throughout the suspension period, temporary food preparation services will be carried out by other food operators operators. Mara also reassured parents to not worry and to maintain contact with the MRSM management to get further information. A media earlier reported that a total of 207 Kuala Klawang MRSM students suffered food poisoning yesterday after having food at the dining hall on Monday, with 4 of them being admitted to Jelebu Hospital after suffering dehydration and diarrhea. The students are in stable condition and under observation at the hospital. That concludes today's edition of Updates at Noon. In our top story, 1 million workers in CMCO areas to work from home beginning tomorrow. Tune in to News at 10 coming up at 10 p.m. on Saluran Berita RTM on My Freeviews channel 123. You can also stream the news by surfing RTM's MyClick. Thanks for watching. I'm Renee Fong. Have a pleasant afternoon.